Hello, everyone. Well, pain management. Most of us have gone through some type of a pain, whether it's some kind of a shoulder pain or knee pain. But what are the holistic ways that we can manage it? That is the topic of discussion today with Manon Bolliger. She has 30 years of experience as a naturopathic physician, helping people like us get over stress and pain management. Welcome so much. Thank you.
Well, thank you for having me here. And I think it's really the main difference with holistic pain management is that we're not just dealing with shutting up the body. In other words, if the body is in pain, we're not just finding a way to just make it quiet. We want to get to why it has this pain. So we're digging deeper into the whole person. And the thing is, there's no such thing as a part of the body that, is the sum total of you that's in pain. It's you're in pain manifesting in your shoulder or your neck or the trauma from the car accident, which could have a physical component, which is often the case with physical pain, but it also has an emotional component. And so what happens many times when, people, for example, have a car accident, and that's a common pain that you need to manage and deal with, they go to their doctor who says, okay, you need to see somebody who does some sort of physical therapy. Usually, at least in Canada, you go to see a physiotherapist and they're working the muscles, the joint, they're rehabilitating before dealing with the trauma to the person. So what happens is they don't heal very quickly. It may take a year, 2 years, 3 years. So in my practice, now I'm retired, but in my practice, I would see people that I'd say, well, what happened? And they say, well, I had a car accident. And what I recognize is that people must deal with the trauma of the shock, the trauma of what happened. And that's not typically being addressed with people who go with physical therapy because they're just working on the body. And then if you go, and get help with just emotional therapy, then they're not working with the fascia, which is really the whole circulatory system of the body. It allows everything to flow and communication throughout the body so that the body can rewire and heal. So I guess what I'm saying, when people are in pain, you've got to find out what came with it. What was happening to you at that moment? And usually that's where we start finding the answers.
So what you're saying is, whatever the pain could be, knee pain, I had a shoulder pain, but this is not only the physical part of it, there's also the emotional part that has to be done together so that the pain can go away easier, right? That's what I'm understanding.
Correct. And, and of course, there's a spectrum. So sometimes if you have a shoulder pain, we just do a little bit of work on the shoulder and it might be fine. But many times when people are in chronic pain, it's because there was some sort of quick fix approach that didn't deal with the whole person. And that's what makes it different in a holistic view of the person. We deal with anything that triggers and sustains pain.
So what would be your approach? We want to tell the viewers, if they are suffering from any pain, it could be for any reason, what would be the approach? Like they should see a physiotherapist as well as seek counseling or emotional or diet? I mean, what would be the framework? That's what we want to understand.
Yeah, so the framework I use is called Bowen Therapy. I'm the CEO of Bowen College, so it's definitely my pet passion. But the reason it's so important, it's a therapy that where less is more. So we're not massaging, we're not cracking things, we're not like families can do this to each other. It's actually very gentle, very effective, and very simple. So, but it has a context. So all the practitioners who have been trained through Bowen College do a general assessment of what's going on for that person, the etiology, where when it happened, and also are aware of the mind-body connection, so that we might use aspects of Chinese medicine, all of that, what's available for us to know what is the best way to treat that person. And one of the things, and why I'm so excited about Bowen College, is because we need a physical approach in so many cases, but we don't want to be working on the body. We want to be working with the body. In other words, it's a bit more interactive, and it allows the body to reset. So we're not like playing God, like we're going to fix this. We're giving the body information with the understanding that it's not actually broken. It just needs rewiring. And we allow the body to reset itself. But in so doing, so many clients or patients or family members, depending who's doing it, have a renewed sense of trust and love for their own body's ability to heal. So it's profound work, and yet it's so simple.
Okay, so can you give us an example, like of a client that I just want to make sure we tell the viewers a little bit more kind of a specific as to what are the steps. So if you could tell a little bit about any client that you did, for example, acupuncture plus the naturopathy plus diet, that's kind of the level I would like us to at least share with our viewers.
Okay, so let's take a patient who has a diagnosis of torticollis. So their neck is injured from a car accident. That would be a great example. Now, as a naturopath, I might look at, like you've mentioned, other therapies, other modalities like homeopathy, like acupuncture, like all of these other things. But my emphasis in my practice was Bowen therapy. And the reason I work with Bowen therapy, it's because the understanding, the philosophy behind that is that the body has the blueprint to self-repair if you can trigger it, if you can allow it and speak to it. So a person, for example, that has whiplash, that type of injury, and it came from a shock because they weren't expecting the sudden bumping of the car, and maybe they had their child in the car and they were very surprised, shocked, and also in fear for their life, because at first you don't know how bad the accident is. If they would come and into my practice, I would do kidney move, which the kidneys are the organ of fear in Chinese medicine. So I would do in Bowen therapy the kidney move to allow the fear to dissipate. I might work on the respiration by doing a move on the diaphragm so that they can take that breath. Many people say, it took my breath away. Well, we can give the breath back. And doing it structurally with the autonomic nervous system. So we're always in trying to be in balance between our sympathetic and parasympathetic system. But it's the parasympathetic system that allows the body to heal. That's why, breathing, meditation, all of these wonderful other self-help techniques work. They put you in parasympathetic. Same with Bowen therapy, but it happens during the treatment. So I would then do the reboot treatment, deal with their kidneys, address their neck, and typically within 2 to 3 visits, they would be finished. They would not have any more neck issues, and they would be like relieved. Their anxiety is gone. They wouldn't have any residual side effects. And I know this because I've seen so many patients, let's say after a car accident, that didn't do Bowen therapy. They went for physio, they went for counseling because they had night dreams, and they were worried about they have flashes of car accidents, but they couldn't heal. And so that's why I can kind of compare to the people that come for Bowen therapy, how this can really speak to the body and allow the body to heal very quickly. So that would be an example of a whiplash and what one would do.
Okay, well, we just wanted a quick 10-minute session today. Thank you so much. Okay. Yeah, and anything else you'd like to add? I just like to keep it very succinct and so that people can digest the information and we are launching our whole platform where people would be able to go through a lot of content at their own pace.
Yeah, I'm trying to think what else I could add. Is it worth me mentioning the mind-body reboot, the part where sometimes, you know what, I'll say it. You can just not use it if it doesn't make sense. Okay. So the other aspect is that, so I gave an example of something that truly is physical, but has mental, emotional components. And sometimes it's the other way around. It will manifest physically, but the cause is mental, emotional. And a very common example is when patients wear their shoulders like earrings, right? You see it in their structure. They're not at ease. They're not comfortable. They're not. How could they be breathing properly? Their body doesn't feel right, right? But it's not ultimately the body's problem. It comes from a mind-body connection. So another workaround, another door, there's so many doors you can open to allow the healing process. But another door is bringing to consciousness what the body is holding unconsciously. So the body's holding the stress and you don't know why, but when you bring it out and you're trained to be able to speak about it, then it's like an insight. Oh, yes, that's what's going on. And you learn then to reposition, to get a better posture, etc. But it may be because of something undealt with. So that's an example.
Sure. Well, thank you so much. I think these are great examples, for us to understand why the holistic approach is so important for taking care of pain management. Thank you so much for being with us. To all the viewers, keep supporting us. We are over 220,000. I've stopped counting, but we are launching a platform with all of your support and of course all the expert support. So stay tuned and have a great rest of the week. Thank you. Namaste.
Thank you very much.